We know that most of those cases are now actually turning out to be the variants of concern, and Alberta is turning out to be a hotspot for those variants. In fact, doctors who are watching this closely in that region say we are looking at a third wave of sorts within the province of Alberta.
I believe that we probably are going into a third wave, and we should know within a week or so. It will be worse than the second wave. And by that, I mean hospitals and ICUs will come under pressure faster.
Now, if we just look at the total number of variant cases in each province, you can see Alberta has the most at more than 1,900. BC and Ontario are second on that list. And overall, there have been more than 6,000 variants of concern identified across the country. Now, the reaction has been mixed after Alberta took the move to pause reopening as variant cases grow and hospitalizations are on the rise. Some businesses in places where the case count is low say there should be a regional approach to reopening. Let's talk about Saskatchewan, also reacting to the rising variant cases, putting the capital back under strict public health measures. The city had nearly 900 cases of the variants as of Tuesday, and more than 50% of the province's total COVID-19 cases are in Regina. The mayor there says the restrictions are necessary.
These are really brutal conversations. These are really brutal decisions to have to make. But given the numbers, it needs to happen, and it needs to kind of happen now.
And the province is also issuing a travel advisory, Todd, especially in the region of Regina, saying that people should limit their in and out of the city of Regina so that they can actually control the spread of the variants and the virus itself, Todd.
All right, and this next topic here, we don't want to exaggerate, but it is something of concern. Younger people being seen in hospitals, Akshay.
That's right, Todd. Several doctors we have spoken to over the last few days, even this morning, continue to maintain that there is a rise in cases amongst the younger population in the country, primarily between 30s and 40s, who are now getting infected, and that too because of the variant. Take a look at this. We have some images here from a doctor who was treating his patients. These are the images of lungs from people in their 30s and 40s. The white fog here that you're seeing here is the fluid in the lungs. Now, that shouldn't be there, and healthy lungs should look black and hollow. The doctor who shared these shots says seeing these cases is upsetting.
Myself and my colleagues, we were angry seeing this, that these people were totally unaware that this could have happened to them, and that they're so devastatingly ill, and they're in for, if they survive, a long recovery afterwards as well.
And hospitals in Western Canada especially are bracing for the worst, Todd, especially with the youth getting infected and many more cases such as these that we were discussing a couple of seconds ago coming into the hospitals. Back to you, Todd.
All right, Akshay Tandon with the latest. It's happening out there in Western Canada, plus is concern for younger patients. Thanks, Akshay. Good to see you.
Thanks, Todd.